At Dr. Russo Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is.
Good afternoon, good morning, everyone. It is my pleasure to welcome you all to today's Innovation Spotlight session. As we gather to explore a critical topic of hypertensive disorders in pregnancy, this topic touches lives in a most profound way. I would like to use this opportunity to talk a little about Dr. Wusu Institute. At Dr. Wusu Institute, we are committed to advancing workforce skills and promoting technological innovation through education, training, and research. Transform your future with our expert-led online and on-site training programs. Whether you are looking forward to master digital literacy and computer skills, harness the power of AI tools, creating engaging content through video blogging, or design stunning websites, we have training tailored for you. We also offer after-school classes for kids in math and computer science to equip in the next generation with essential skills for the future. For more information, visit doinstitute.org or contact us on 05391 47900 or 02071 15446. A special thanks to our sponsor, Arise Graphic Professionals, your trusted provider of graphic design, web design, and hosting services. Now back to our main innovation. Hypertensive disorder in pregnancy, a condition that affects many expectant mothers and can pose serious health risks. It is important we hear from someone with both knowledge and experience in this field. It is my honor to introduce our esteemed guest today, a highly experienced and passionate midwife, Ms. Krama Margaret. She is a dedicated and experienced registered midwife with 11 years of expertise in maternal and newborn care. She holds a Bachelor of Science in Midwifery, equipping her with the knowledge and skills to provide high quality care to expectant mothers and their newborns. Throughout her career, Ms. Margaret has been committed to ensuring safe pregnancies and deliveries, offering compassionate support to mothers and families. Her extensive experience in midwifery has made her a trust healthcare professional dedicated to improving maternal health outcomes through patient-centered care and best practices in childbirth and postnatal care. Today, she joins us to share her wealth of knowledge on hypertensive disorders in pregnancy. Please join me in giving a warm welcome to Ms. Krama Margaret. Thank you for joining us, Madam.
Thank you. Good afternoon, good morning, good evening, wherever you are watching us from. I'm Margaret Cromer, and our topic for today is hypertensive disorders in pregnancy. So, WHO defines hypertension as a blood pressure of more than 140 or equal to 140 over 90 or higher. So, hypertensive disorder is when a pregnant woman have an elevated blood pressure of 140 of more than or equal to 140 over 90, or when the first BP check increases by 30 millimeters of mercury, and then with the diastolic 15 millimeters of mercury. So hypertensive disorder has been classified into, have the first one, chronic hypertension. Chronic hypertension is detected in pregnant women before 20 weeks of gestation or before getting pregnant. So when a pregnant one comes to your facility and you check her BP and it is high, that is if it is more than or equal to 140 over 90, it means that person is having chronic hypertension. And we have gestational hypertension. It It's detected after 20 weeks of gestation. That is when the client presents with hypertension after 20 weeks of gestation without proteinuria. Okay, and we have preeclampsia. Preeclampsia is hypertension, which is 140 over 90, and in addition with proteinuria detected after 20-week gestation. And we have, still with the classifications, we have preeclampsia with severe features. That is when there is high BP after 20 weeks gestation, and then with proteinuria, in addition to end organ damage. And in addition, we have chronic hypertension with superimposed preeclampsia. This is when a person with chronic hypertension later develops proteinuria and sign of end organ damage. So sign of end organ damage includes proteinuria, increased creatinine levels and scanty urine. So let's say if a person comes with you, or if you're a pregnant woman, you've been diagnosed of gestational hypertension, later it can proceed to preeclampsia and then severe preeclampsia. And some of the signs of end organ damage include severe headaches. So if you are a pregnant woman and then you've been diagnosed of preeclampsia and then you start having severe headache, severe epigastric pain, visual disturbances, you can be diagnosed as having preeclampsia with severe features. And then it also has some blood clotting disorders. And in addition, with high BP, if a pregnant woman has been diagnosed with chronic hypertension or preeclampsia, it can proceed to eclampsia, which is another classification. The eclampsia is like epilepsy. In Twi, we call it a triary. So if you are pregnant, you can get similar condition. Wobɛtumi anya nyinsɛm atwa because of this hypertensive disorders. So let's look at the etiology or the pathophysiology of these disorders. So we're going to talk about the preeclampsia, okay? It is characterized by abnormal placentation. So with this placentation, at 20 weeks, the trophoblast or the placenta embeds properly in the spiral arteries of the maternal blood vessels. During normal pregnancy, due to loss of muscular elasticity of the blood vessels, the blood vessel is able to dilate properly for the trophoblast to embed in it. So during this time, most of the clients only have lower BP due to a system of low blood pressure to an increased blood supply to the placenta and then the fetus. So if you're a pregnant woman and you are in your second trimester, so we have something called first trimester, second trimester, third trimester. First trimester starts from day one of pregnancy to the 12 weeks. And then second trimester starts from 12 weeks to 24 weeks. And then third trimester starts from 24 weeks till you deliver. So that's the trimester. So as I was saying, in normal pregnancy, from 16 weeks to 20 weeks, the placenta embeds properly into the spiral arteries of the mother. That all these things is in the uterus, so that the baby will get enough blood supply. So as I was saying, those with normal pregnancy will have low BP during second trimester. But due to these disorders in preeclampsia, some of the clients will have higher blood pressure because this loss of muscular elasticity of the spiral arteries didn't happen. And so therefore, the blood vessel becomes constricted. So when it happens like that, the heart has to use a pressure to pump blood across the placenta to the fetus. So when these things happen, the placenta is not going to get enough nutrients and oxygen supply. So it becomes distressed or becomes stressed. Ɛte sɛ nea wanya aduane adi a wanya bibi te sɛ kwashiorkor anaasɛ ɛna sɛ wobi kora if you are not able to get enough nutrients, you become malnourished. So let's say malnourishment of the placenta will later release toxins, some such as cytokinin, into the maternal circulations. And preeclampsia too is also known as multiple organ disorder, meaning it can affect almost all the vital organs in your system as a pregnant woman. So we see how serious this condition is and how deadly it could be to a pregnant if care is not taken. So once this placenta release these toxins, it destroys a vital thing called endothelial cells. Endothelial cells are cells that lines within the blood vessels, meaning every organ or every blood vessels contain these cells. And every organ is being supplied with blood. Definitely, it will have these vessels. So once this endothelial cells is being destroyed, and one of the main functions of this cell is to produce nitric oxide and then prostacylin. These are mediators for vasoconstriction and prevents it inhibits platelet aggregation. It prevents formation of clots within your blood when you are pregnant and having um, when you are pregnant. But once its function is being altered, it causes fluid to seep into the surrounding tissues. So within the liver, we can have edema of the liver, and within the kidneys too, it can affect the glomerular capsules, therefore allowing plasma protein to seep into the urine. Nti mobɛkae a ɔpefoɔ bi akɔ clinic a yɛkyɛke BP a ne yɛakyɛke nso because we want to know if you are having urine protein or urine glucosuria, so that if you are having urine protein or proteinuria, you will pull out further to look out for what is causing that. If it is not BP, at times you having UTI, urinary tract infection, also can cause this proteinuria. And at times you are having a kidney disorder, that one too it can. But pregnant women too can get proteinuria due to distraction of the kidneys. Okay, so let's look at some of the. So once these endothelial cells are being destroyed, one of its functions is to dilate the blood vessels. When the blood vessels are being dilated, the BP is definitely reduced. But once it's been destroyed, the blood vessels will become constricted. So constriction of the blood vessels will increase the hypertension. So blood vessels in the brain will be affected. Blood vessels in the lungs will be affected. Blood vessels within the liver is going to be affected. As well as the blood vessels supplying blood to the fetus can also be affected. So let's just look at some of the risk factors. The actual cause of this disorder is not known, but it is being associated with some. It is being associated with some of these things. So we have maternal risk factors of getting preeclampsia. You have primigravida. If it is your first time of getting pregnant, ABS said, when you say that your first pregnancy, you can get preeclampsia. And I say, if you've gotten a new partner, that one too, you can get preeclampsia. And we have extreme maternal age less than 18 years and more than 35 years, you are at higher risk of getting it. Even though in between those ages, you can still get it, but it is more prevalent in women below 18 years and then 35 years. That is why at times you see a 15-year-old girl who is pregnant is having a BP of 200, 120. It is because of this disorder. It can affect anybody, but it is more prevalent in black people. According to research, it suggests that black people have higher risk of getting preeclampsia. And then we have family history. If you have a family history of this condition, definitely it is likely you will get it. And then if you have preeclampsia in your previous pregnancy, it is likely you will get it. At times, they've been coming there with two previous history of preeclampsia, so it can occur again. So pregnancy after assisted reproductive technologies, if you undergone IVF and then gift and others, those ones you have a risk of getting it. And also pre-existing diabetes mellitus. If you are a pregnant woman and then you already have diabetes, who is area, ready to say you endothelial cells destroy these endothelial cells, predisposing you to get hypertension or gestation, either gestational hypertension or preeclampsia. And preeclampsia or gestational hypertension. And then if you develop any medical condition like diabetes or hypertension, when you have hypertension, you wait to enya preeclampsia. So, you better than you see what preeclampsia. Measuring of blood pressure. Need to now be a for a clinic midwives no measure the blood pressure no. And then in addition they do urine testing. Okay, so urine testing. And then we have another test which is placental growth factor. This test is not done in most of the hospitals, but some of the hospitals too are doing it. It's a placental growth factor is a protein that plays a role in the development and growth of a placenta. So this particular test they do to know that if the placenta or now a na wo wia ye no, if se na ho ɔden no okay. Wobɛtumi anya BP, wonyim na wonya BP a na ɛfiri ɛkyerɛ no, which is the placenta, okay. Ɛnya mogya dodoɔ a ɛwɔ sɛ ɛnya a, release toxins na asɛe nipadua nneɛma no. So with the management, you need monitoring and then assessment. Nti na wokɔ antenatal biara na yɛkyɛke wo BP, yɛkyɛke wo urine, yɛahwɛ wo mood because this condition normally allows fluid to retain in your body. So at times you have puffiness of the face, of the hands, and then of the feet. But at times we used to say women na onase taatae a ɛkyerɛ sɛ wobɛwo ɔbɛma kɛseɛ. But ɛnte saa ɔnhwɛ yi a ɔne ɔba no nyinaa bɛtumi afiri because your organ and then your organs are not functioning properly. But ebi wɔ hɔ nso a you can have edema of the feet and ebi wɔ hɔ a ɛnyɛ hwee, it can be due to impaired venous drainage. Emogya no a ɛntumi mfiri wo nan ase nkɔ soro ntɛntɛm because of pregnancy no nti ɛbɛtumi ayɛ saa. And afei nso if you are being diagnosed of preeclampsia, they will do a blood test. Some are a bit expensive, but it's worth it. It will bring out all the abnormality that is taking place in your system, especially the liver, the kidneys. Okay. So with the fetus, you do scan into who BP need the biobanic scan the mouth. It is important. Also, they do scan to detect if your baby is growing well or if the baby is not doing well. And then we do fetal heart monitoring. At times too, we have ABCTG, our national stress test. At times they do it to notice the activities in the fetal heart, if the baby is doing well or if the baby is not doing well. They do that. And also with the management, we have antihypertensive medication. One banner I want to be clear. The rules say osmiti ya mi ya no weja no what if But once your placenta is there and it's not receiving enough nutrients, the condition will progress until the placenta is being removed. This preeclampsia, as it is, doesn't have any cure. It doesn't have any cure like malaria. If you come in with malaria, you'll be given anti-malaria and you'll be fine. Preeclampsia doesn't have a cure, so it can only be managed. Nti yɛsrɛ mo sɛ woba na sɛ ebi a wo BP wɔ soro na sɛ bi a doctor take decision dɛ mama wa na wate ase ebi wɔ hɔ a some of these women will not follow the treatment or how to manage, they will not follow it. They will say oh menum aduro na me ti yɛ mmea nti ɔbɛba no na ne BP no ɛkɔ soro ankasa. BP no nso ɛkɔ soro saa na ɛde ɔhaw bebree ɛna ɛyɛ den ɛba. And so they can give you some of these antihypertensives like nifedipine, labetalol, hydralazine, and then metaldopa. Okay, to control the BP. High BP can cause stroke in pregnancy. It can cause a lot of harm. And so the fourth thing is delivery. Sometimes, since this condition doesn't have a cure, the specialists or the doctors will manage it with hypertensive disorders, and at times they will give you low dose of anticoagulant like aspirin. Nti bi a wonyim na sɛ bi a yɛma wo aspirin a, it is because ade na yɛfrɛ no endothelial cells ne ɛwɔ nipadua no mu ɛwɔ wo tii no mu ɛma ɔmogya ne mfɔme cross ɛma ne mmobɔ akɔba ɛsiane sɛ nyinsɛn no placenta akyiri adeɛ no ɛyi nneɛma bi a ɛbɛsɛe saa adeɛ no nti no ɛbɛma ɔmogya no atumi ɛdɛn abobɔ akɔ ɛbɛfɔme clot. Nti they give you this aspirin to prevent clotting of your blood. Nti no woba ne ɛma wo biribi a na wɔadi so. So at times they will manage with all these drugs, but the condition will not regress. It will rather be increasing. So you will get to a stage called one of the classification, that is preeclampsia with severe features. So when you get to this state, they will not have any option than to remove your baby. Even if you are 30 weeks, 32 weeks, no matter the week that you are in, you will have to remove the baby. Else, the baby and that placenta causing this problem will kill you, will damage your organs. So that is why at times, if you will come across someone who has had, let's say, two previous preeclampsia, severe preeclampsia, having kidney damage or kidney failure at the end of the day. It is because of this. The kidneys is being destroyed by the toxins from the placenta. So when your baby is not more than 34 weeks, they will give you steroids like dexamethasone. It will help in the maturation of your baby's lungs. So whenever you deliver your baby, at least the baby can breathe. The baby doesn't breathe when it is in your uterus. Oba no ɔhyɛ wo yam a ɔnhome na kɔma ne bɔ. So once your fetus or your baby is lesser than 34 weeks, yeah, at times 30 weeks, 32 weeks, because of the severity of the condition, you have to do cesarean section and remove your baby. So due to that, at times we give you dexamethasone to help in the maturation of your baby's lungs so that the hypertension and its complications will reduce. So let's look at um, some of the complications of this condition. Some of the complications include eclampsia, which I said earlier. It is called nisemu echa. So it happens when your blood pressure increases. Okay, when the blood pressure increases, it causes vasospasm, meaning constricting of your blood vessels. So blood vessels never brain when it becomes constricted. When it becomes constricted, you can have headaches. And within an antenatal card, which is a danger sign if you have severe frontal headache because your brain nervous system and if it's in your pipe, it can rupture. The blood vessels in your brain or within your head can rupture. because of pregnancy. Okay, and at times you have dizziness when you submit me at times you vomit due to cerebral irritation. So brain no, blood vessels now want to constrict. At times you can get edema. One bit me due to distraction of that cells, endothelial cells. As I said, endothelial cells no organs ni nyinaa mu. Nti once now say baby kuna will be a best functions now when you're impaired. Okay, into your brain no wobɛnya edema wɔ hɔ hɔ bɛho within no w'ani hu w'ani hu deɛ anka wobɛsi wo ti aho a wode ba but w'ani hu it is within nti no woba na obi pi wɔ soro a you're likely to have seizures which is called the eclampsia and it is similar to epilepsy. It is epilepsy ne biribiara te sɛ epilepsy nti no wonyim a wobɛtumi anya epilepsy nyinsɛn mu etwa saa na ayɛ ka no nyinsɛn mu etwa sɛ obi pi ne kɔ soro na sɛ wɔntumi arepɔte ama yɛanhwɛ wo ntɛm a ɛno nti na yɛ sɛ wonyim na wo tie ɔyɛ a bra hospital because of the risk factor. At times ebi wɔ koraa na ɛnyɛ BP sɛm ebi ɛyɛ malaria but because headache too is associated with high BPs in pregnancy. That's why we are saying you should report to your health facility if you have such a sign. And with some of the complications, we have kidney problems. I said earlier that because of these endothelial cells within the glomerular capsules, because of lack of blood supply to the kidneys during pregnancy, if you are having endothelial dysfunction, the afferent arteriole, the one supplying blood to your kidneys, the lumen becomes restricted. Okay, so the kidneys will not get enough blood supply, and some of its functional units will destroy. So it can damage your kidneys. That is why at times, as I was saying, people who have had two previous preeclampsia and eclampsia, getting pregnant for the third time can have kidney damage. It can happen. So you should take note of it. And also with the liver. Since this same cell which is being destroyed by the toxins released from the placenta is somewhere there, you can have edema of the liver, gastric pain. When you begin to have epigastric pain, it could be that the liver has been affected by the pregnancy or by the hypertension. And at times too with the lungs of someone having preeclampsia, to there can be this similar thing. There can be accumulation of fluid within the lungs, which is called cerebral pulmonary edema. Into wahrawa na wode home no, home in and out ne so. Because of this BP, into betimi enya, inso betimi egyina mu, egya mu so you cannot breathe properly. And just cause udu hospital ka ye dey oxygen na dey sisi so. Into if you see the slightest sign and symptoms are also to become hospital, then it can affect your coagulation system. As I was saying, one of the functions of the endothelial cells is to synthesize nitric oxide and then prostaglandin. They prevent formation of blood clots. So once its function is being impaired, blood never clot into the time that I be a CS, I hear clotting factors to act in that time, it will not stop. Bleed emoji and clotting flat the clotting aspect have been used into bleeding. Into this condition, I bet me I'm watching moja too, and I moja and swab. And then I've already spoken about cerebral edema, so that one can have seizures. And then to the fetus, since the since the fetus take its blood supply from the placenta can become constricted and it can rupture. Baby ni maame ni mogya ni hyia no. Baby ni fa ni mogya no onyema it doesn't mix. The fetal blood and the maternal blood doesn't mix. So at that point, the blood vessel supplying blood to the placenta, it can rupture a bit pipe. So when it ruptures, The person can bleed between the placenta and the placenta bed, between the placenta, in between the uterus and then the placenta. At times it can be concealed. That is what we call abruption. Abruption, and we call it abruption, and as a placenta abruption. So when this thing too occurs, it is going to put you under critical condition. You might have you might collapse because you are bleeding inside without knowing. Okay. And some of these signs too is characterized by abdominal pain. Most of na then to solve, but any one account. We say if you get into labor, your abdomen become hardened and then it wears off. But with abruption, ebe ya wo denden dia to aso na eye wo ya. Eye wo do saka bia ebe ya wo ya. So take note of this so that if you begin to have some of these signs, you note it and then you report to the nearest facility. So once there is an abruption, which is premature separation of a normally situated placenta, once this thing occurs, the baby is not going to get enough blood supply. So the baby might die, or the mother may need an emergency cesarean section to save the mother from bleeding to death, move the baby and then move the placenta and they save the mother's life. It's a blue hormone who are at times the client can bleed to death despite being many interventions being made. Because if you have lose more of your circulating blood supply, you can die. It's a table on Mayana and yet doctor foreigners foreign but if you are home due to the how the situation is like. At times too, we are able to save a lot of these clients. Okay. So with baby, you can get IUF, the baby can die, and then you can get preterm baby because maybe who are 28 with 32 is the one starting the baby you ban preterm. Okay. And then with blood supplying to the fetus, due to vasoconstriction, the placenta can be ischemic. Enya moja do nti no so betimi awa kwala wo yeketekete but no wanyi. Any friend IUD out. At times the baby will come with bone fingernails but might be small and tiny. So let's take note of this and report at the right time. And you can get another condition like um, HELP syndrome. With this one, your blood cell becomes to break down. It hemolyzes. And then you have abnormal liver enzymes. Your liver no your organ no. Na edwuma na ɛyɛ no nyinaa so bɛte. So benya abnormal liver enzymes. Ɛna wobenya low platelet nea wopira ɛboa ma mogya na no si no. Ɛno ne nso ebesi ano kwan. Nti complications ɛwɔ saa preeclampsia ne hypertensive disorders no. Ebi yɛ PPH awoakyi mogyatuo. After delivery, you can bleed because your clotting factors has been already been used, so you can bleed. And then your organs like the liver, kidney, lungs, and then brain too can be destroyed by these conditions. So I think we have to take note of this and then act appropriately. So I will be ending right now. Into no mafuto kakra bema apemfo ne say onyim no ne so BP was sure. Procedures bia ya do befam no so kudi so. Sene be ya we can save you and your baby. Healthy baby, healthy mother, happy nation because at times what is so beautiful when we kakra. So in case you come across a pregnant woman with edema, like nenasia, please, if that person is not attending antenatal care, encourage the person to go for antenatal clinic so that the edema of the client will be ruled out and it will prevent maternal death and then neonatal death or losing the baby. At times you can lose both through this preeclampsia eclampsia thing. So we see how difficult this condition can be. Means that there need at times you will hear some people saying onyim keke. It's not just like that. It can bring a lot of problems. So I will encourage everybody, including partners, family members, friends, to at least help these pregnant women. At least to these women will be depressed due to their problems, and then if they are admitted because of lack of finances, they will tell you, Madam, Madam, me kofa me nneɛma ba ɔmma biem ɔbɛba ne wɔ emergency. So I'm pleading with everyone watching me that let's help our pregnant women so that we can help prevent some of these preventable maternal deaths. Some of these things cannot be prevented. In fact, one man tell me about na the kidneys are say, the liver say, was starting a breaking the blood cells. You go home, obey your baby, but the person might not survive. So let's help encourage our pregnant women to attend antenatal care because early detection saves life. Sɛ bia yɛhu sɛ ɔwɔ BP ntɛm a yɛde wotu ɛdo ntɛm a at least ɛbɛboa. And so monitoring will be there will be close monitoring so that you wouldn't get severity of this condition. Okay. So let's help our pregnant women. And pregnant women, yes, sure, mama, yeah, can be very monty so that some of these things can be prevented. Thank you.
Thank you very much, Miss Kramer. We are grateful for this education. Nurse kyerɛ sɛ nyinsɛn nankasa n'anya adeɛ a ɛda fam saa koraa. Yɛn
Yeah.
a yɛawo bi pɛ no deɛ yɛnim sɛnea ɛsi tie nti nea ɔka no yɛte aseɛ paa and we have experienced it, so we are grateful. Okay, please, we have some few questions that we would like to get the answers from you.
Okay.
Okay. Um, do hypertensive disorders during pregnancy increase the risk of future heart problems?
Yes, it can increase the incidence of future heart problems because it is an organ which is involved in these abnormalities. So it can definitely be affected.
Oh, okay. And okay, our next question is how long should women be monitored after delivery if they had hypertensive during pregnancy?
Okay, with the monitoring, after I think 1 week, they at times those with these hypertensive disorders spend much more longer time than those without any hypertensive after delivery. They spend more time and they are asked to come for frequent review. But if after delivery, 6 weeks after delivery, the BP resides, then it means that person was having gestational hypertension. But if after 12 weeks, the BP is still there, then the client has definitely gotten chronic hypertension. So I think I will encourage everybody to do regular monitoring of BPs because the other time we had a client, I think she was having preeclampsia. She had preeclampsia when she got pregnant, but she later came in with ectopy, but the BP was high, meaning she didn't monitor the BP after delivery. So some people to after delivery doesn't go, you become hypertensive patients for life.
Oh, okay. Okay. And our next question is can a woman with preeclampsia have a normal vaginal delivery?
Oh yes, depending on the time that the preeclampsia settings. At times, some have a normal vaginal delivery, and development of preeclampsia can just happen within an hour. You have a normal BP today, but the next day you can have severe BP. So at times, when they comes in labor, at times some have it, so some are able to deliver, and others too we take them to theater. We give them a mark. So those with imminent eclampsia or severe features. For those people, at times you don't want the eclampsia to set in. We don't want the eclampsia to set in. That is the same way we don't want it to set in. So when they come in with severe features, we start magnesium sulfate. It is one type of drug that it's anticonvulsant. It prevents the seizures. And I say Emma same way it prevents the seizures. So we give it to them and then we remove the baby afterwards. So this particular type of drug, you will receive it for at times more than 24 hours to prevent the seizures, in
Oh,
addition to
okay.
antihypertensives. So if you have preeclampsia and you are in labor, you can deliver, depending on the severity.
Oh,
And
okay.
at times,
But
if
please, so can also nutrients play a role in this condition? Maybe there are certain food that pregnant women can eat that can also not or prevent them from having preeclampsia or any other disorders in pregnancy.
yes, with the nutrients, it's like if you eat more nutrients or excess nutrients, you can definitely get gestational hypertension. And then gestational hypertension to gestational diabetes, sorry. If
Okay,
you eat unnecessary foods like anything that comes around you eat, you still have some pregnant who have been eating. Any food that
that's the
passes away,
cravings.
she will grab
The cravings.
the
That's the cravings. If the
craving,
cravings
yes, she
come,
will
at
grab
least you
it.
have to
So
control
once you have to control it because if you catch everything that passes your way and then you gain excess weight. And obesity too is a risk factor. With obesity, you can get gestation. That one too will increase your risk of getting the preeclampsia. So definitely some of the nutrients can contribute to it.
Oh, okay. 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 Our last question. What role can family and community play in supporting pregnant women with these conditions?
Okay, with the role, you see, at times when women are pregnant, they get mood swings. At times, they become psychological imbalance. So, for instance, if she is having high BP and then she has been admitted to hospital, and doctor says, "I want to take the baby," and the client doesn't want to, despite you being explaining the risk factors, you say, "No, I don't want you to take the baby." Yeah, you can involve the partners. At times, when the mother or when the husband comes in, they can convince her to change their mind, or they can encourage. At times it's financial matters, so if the husband is not having money to support these women, I think the family too can also provide some financial help. Because if let's say God forbid, if that person dies, definitely the family is going to pay the hospital bills and then buy a coffin and then make a hand. So the family too has a role to play in this.
Okay. Okay. Thank you very much, Ms. Kramer. We are grateful for having you on our webinar. Okay, as we wrap up today's session, on behalf of my team and I want to extend a heartfelt thank you to our incredible guest, Ms. Kramer Margaret, for sharing such valuable insights on hypertensive disorder in pregnancy with us. A big thank you as well to all attendees for being part of this conversation. I hope today's session have sparked new ideas and perspectives. Let's continue exploring, learning, and driving positive change in our fields. A special thank you to our sponsor, Arise Graphic Professionals, your trusted provider of graphic design, web design, and hosting services. Once again, thank you all for joining us. Stay connected, stay inspired, and we look forward to seeing you at our next Innovation Spotlight webinar. Have a wonderful day. Bye bye.
A Dr. Russo Institutes, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills.